Thank you for having me here. I'm very happy to share my experience. I'm Elena Bitrian. I'm an adult and pediatric glaucoma specialist, and I also do quite a bit of cataracts. My experience with the laser, it began, I believe, 2 years ago, when it was just freshly introduced. I was able to test the laser. I did a couple of cases. It was on trial. Then we had another chance to trial it again. I was fighting for the laser because I saw how much it could help us to treat our population of patients, pediatric and adults, at Bascom Palmer, and we finally got it. So since I got it, I use it every week, literally. We do get a lot of traumatic cataracts, for example, other type of cataracts that are not straightforward. Like last week, I did a child that had a traumatic cataract a year and a half ago. The anterior capsule was blown up, was destroyed completely. So we were able to do the cataract, but we couldn't do a posterior capsulorhexis with a vitrectomy. So that child, a year and a half later, developed a PCO, and then it's somebody that would not tolerate a laser like an adult would. So we just brought him for EUA and just do the laser. So that's something that is safely done. So to me, just when I heard of it, I was I want to try it, because this is something that applies to pediatrics. There's few people that are kind of thought on the pediatric wall or the special need patients. So that was for me, it's I want to get my hands on it. I want to try it. I want to see, not just by hearing what other people tell me, but have it on my own hands, my own patients, and see the result. And to me, it just allows for better treatment, expanding on these type of populations that are the ones that they need the most care. And the more I get to use it, the easy of use and everything, I can see why, how it's gonna fix in my practice, and I'm gonna apply it earlier on. It's just I'm very pleased, because it's just a few months ago, I didn't have that possibility. I couldn't offer that to the patients. For me, it's the ease, because with pediatric patients, it's a long-term run that you have. The rapport with the families, the child also, just explain them, we'll put you to sleep, we'll check. We have to do, a lot of times we do exams under anesthesia, we put the kids to sleep, and that's it. And then you explain the parents, and I have this possibility to have the laser. There's not gonna be incisions, there's not gonna be bleeding, there's not gonna be risk of infection. And we do that to optimize the visual outcomes for this patient. And this is very well received by the parents. For me, I love it. It's less invasive. It's another tool that we have on the armamentarium, which again, for pediatric surgery, is there's very few of these possibilities. Same as my colleagues. I have colleagues that don't do pediatric cases, and they are already oh, this is great. It's I'm going to use it. We have it handy. We just can roll it to the operating room, bring it to a minor procedure room for other patients that need different positioning. It is something that I'm doing now. And I like it. I think it's better. It's quieter. Thank you, everybody.